Pharyngitis and tonsillitis. So this is an infection of the throat and tonsils. Most sore throats are due to viral infections and should not be treated with antibiotics as they subside within 3 to 5 days. However, it's important to diagnose streptococcal pharyngitis since it may give rise to abscesses in the throat as retropharyngeal and peritonsillar abscesses, as well as complications that involve organs like kidneys and the heart. Streptococcal throat infections require treatment with antibiotics in order to reduce the complications. So the causes are viruses, hemolytic streptococcus, Haemophilus influenza, and other gram-positive bacteria. The symptoms are fever, difficulty in swallowing, sore throat, runny nose, and cough. The signs that are usually elicited are reddened throat, enlarged and reddened tonsils, sustained high-grade fever, palpable tonsillar lymph nodes, as streptococcal pharyngitis, runny nose, which suggests viral, cough suggests viral, red eyes suggests viral, whitish exudates at the back of the throat, as well as whitish tonsillar exudates. Also, scarlet fever rash. Investigations are FBC, monospot tests, throat swab for culture and sensitivity. Main treatment objectives are to relieve symptoms, to recognize and treat streptococcal throat infection, and to relieve pain. Non-pharmacological treatment: warm, salty water gargles. Pharmacological treatment: for pain relief, first-line treatment, you give paracetamol oral. In adults, 500 milligrams to 1 gram 6 to 8 hourly. In children 6 to 12 years, you give 250 to 500 milligrams 6 to 8 hourly. And 1 to 5 years, you give 120 to 250 milligrams 6 to 8 hourly. At 3 months to 1 year, give 60 to 120 milligrams 6 to 8 hourly. Or ibuprofen oral in adults 200 to 400 milligrams 8 hourly. In children 7 to 12 years, 7.5 to 10 milligrams per kilogram 6 to 8 hourly, with a maximum dosage of 30 milligrams per kilogram or 600 milligrams per day. And 4 to 7 years, give 7.5 to 10 milligrams per kilogram 8 hourly, with a maximum of 30 milligrams per kilogram or 450 milligrams per day. For treating the infection, first-line treatment, you give amoxicillin oral in adults 500 milligrams 8 hourly for 10 days, and in children 6 to 12 years, give 250 milligrams 8 hourly for 10 days. 1 to 5 years, 125 milligrams 8 hourly for 10 days. Less than 1 year, give 62.5 milligrams 8 hourly for 10 days. Or amoxicillin clavulanic acid oral in adults 1 gram 12 hourly for 10 days. In children more than 12 years, give 501 to 5 milligrams strength tablets 12 hourly for 10 days. 6 to 12 years, give 5 milliliters of 457 milligrams suspension of amoxicillin clavulanic acid oral 12 hourly, and 5 milliliters of 250-62 milligrams suspension 8 hourly for 10 days, and those doubled in severe infection. For 1 to 6 years, give 5 milliliters of 228.5 milligrams suspension 12 hourly for 10 days, in those doubled in severe infection. For 1 month to 1 year, give 2.5 milliliters of 228.5 milligrams suspension 12 hourly for 10 days, those doubled in severe infection. Neonates Give 2.5 milliliters of 228.5 milligrams suspension 12 hourly for 10 days in those doubled in severe infection. Or you give amoxicillin clavulanic acid IV in adults 600 milligrams to 1.2 grams 12 hourly for 10 days. In children 1 to 12 years, give 15 milligrams per kilogram 12 hourly for 10 days. Or crystalline penicillin IV in adults 2 to 4 mu 6 hourly for 10 days. In children more than 12 years, you give 2 to 4 mu 6 hourly for 10 days. And 1 to 12 years, you give 0.6 to 1.2 mu 25 milligrams per kilogram 6 hourly for 10 days. And do not give tremozazole for acute streptococcal throat infections. Second line treatment, you give cefuroxime oral 250 milligrams 12 hourly for 10 days. In children more than 12 years, you give 250 milligrams 12 hourly for 10 days. And 3 months to 12 years, you give 10 milligrams per kilogram 12 hourly for 10 days. Or cefuroxime IV in adults 750 milligrams 8 hourly for 10 days. In children more than 12 years, give 750 milligrams 8 hourly for 10 days. And 3 months to 12 years, give 25 to 50 milligrams per kilogram 8 hourly for 10 days. For treating the infection in patients allergic to penicillin, you give erythromycin oral in adults 500 milligrams 6 hourly for 10 days. And in children 2 to 8 years, you give 250 milligrams 6 hourly for 10 days. 1 month to 2 years, give 125 milligrams 6 hourly for 10 days. Neonates, you give 12.5 milligrams per kilogram 6 hourly. Or you can give azithromycin oral in adults 500 milligrams daily for 3 days. In children more than 6 months, give 10 milligrams per kilogram daily for 3 days. Referral criteria: you refer patients with recurrent tonsillitis, retropharyngeal and peritonsillar abscess to an ENT specialist.